Good evening, everyone. It is February 1st, and this month we are celebrating Heart Health Month. And in honor of Heart Health Month, we're having a seminar this evening to kick off the month and to share some information about heart disease and what I like to say, have a heart to heart, because a lot of this information is a little scary. And it doesn't have to be scary, but we can come together and really talk about heart disease in a really meaningful way, and hopefully inspire some of you to really take some ownership for your health and start moving in the direction of living a healthy, well-balanced lifestyle. So the goal of tonight's conversation is to talk about your risk factors. We want to make sure that you understand your risk, talk about the signs and symptoms of heart attack and stroke, because prompt awareness is critical to getting the treatment necessary to save lives. And we're also going to talk a little bit about some holistic strategies that you can do every day to manage your heart health. And as always, if you have questions, this is what this is all about. It's really a forum and a discussion, and the discussion does not have to end today. If you have questions, or you're just curious about something, or maybe you're recently diagnosed with a risk factor or recently had a cardiovascular event, this is what this is all about. We're here to be a community for one another. We're here to learn from one another, and we're here to share and inspire one another. So please don't hesitate to reach out. It will be 5 years this February since I had my pulmonary embolism, and I cannot believe that it has been 5 years. It doesn't seem that it has been that long, but every year since then, I have celebrated Heart Health Month in a very different way. I've celebrated as a survivor. And prior to that, I was really active in American Heart Association, and I advocated for patients, and I did participate in Heart Health Month. But it's just different when you are participating as someone who has gone through a heart condition. And so this one's pretty special for me, because this is my 5-year anniversary, and I am in better health than I have ever been, arguably, since since this happened. This was really a huge wake-up call for me, and it was an opportunity for me to really become the best version of myself in mind, spirit, and body. And so if there's anything that I want to really highlight in today's conversation, is that none of these risk factors or none of these conditions need to define you. They don't need to stop you. What they can do is redefine you. What I mean by that is they can inspire and empower you to make a change, and to make that change, go through that change, and then use your story to help others, because there are ultimately others who are right there where you were as you were going through your event. And so I think that's probably the most important part of today's conversation, is don't ever let a heart condition or heart disease define who you are. Use it as a way to inspire you to motivate others. And that's why I'm here today, and that's what I'm doing. That's why I'm doing what I'm doing. So I see that there were lots of folks that have joined. I'm so excited that you're all here. Hi. I would love to just open up, since there are some folks that have joined us, I would love to know, out of everybody who's there, who is currently managing a heart condition. You can just get a thumbs up or a heart, whatever you want to do. But I can imagine that there are many of us who either have some risk factor, whether that's high blood pressure, diabetes, physical inactivity, maybe we're smokers. So many of us actually have risk factors for heart disease. And so on any given day, we're all managing these conditions, and we're all managing these diseases. Or maybe we've had events in the past, and because we've had that event in the past, we're much more likely to have another event in the future. So it's really common to have a heart condition or heart disease, or cardiovascular disease, as we call it. And in all reality, cardiovascular disease is the leading cause of death worldwide. It is the #1 killer of women in the US, and it accounts for 1 out of every 3 deaths. So it really looks like something like 1 person dies every 40 seconds from cardiovascular disease. And we talk a lot about cancers and we talk a lot about respiratory conditions, but the reality is that cardiovascular disease kills more than those 2 conditions combined. And it's often known as a silent killer because there are many cases in which patients never have a diagnosis of heart disease or high blood pressure or diabetes, but they die from sudden cardiac death. And that is their first presentation of a heart condition or heart disease. And so it's really something that we all need to be aware of because we are either affected personally or someone we know very close to us is affected personally. So it's important to spread the word. It's important to spread awareness. It's important for you to understand your risk so that you can help others determine their risk. And then most importantly, you've got to know the signs and symptoms of heart attack and stroke because it might not be for you. It might be for somebody else. You could be in the grocery store and you can come across somebody who might be having symptoms. And you could say, it really looks like you're having a heart attack, or it looks like you're having a stroke. We need to call somebody. So you want to be aware of what those symptoms are. So the first thing I'm going to ask is whether or not you really know your risk. And I will have to say that I'm pretty comfortable that I know my risk, but there are actually components of my health that I'm not sure of. One of them is my cholesterol. I haven't had my cholesterol checked in quite some time. In order to accurately determine your risk, you've got to know some information. And that information is, what is your blood pressure? What is your cholesterol? What is your weight? Do you have a personal history of heart disease? Or maybe a family health history of heart disease? So someone in your family, like mom, dad, brother, sister, somebody that you're related to in terms of your heritability, has had a heart condition, either heart attack or stroke. And if you have that your blood sugar for diabetes, so blood sugar is another one. If you know that information, you can actually calculate your risk. And there are risk calculators out there. The American Heart sponsors a risk calculator. You can find it on their website, and I can send you information. I can actually post some things to this video too at the end of this conversation so that you know where to go. But you really need to know your risk. And the reason why you need to know your risk is because then you can manage it. The reality is that we can't remove all of our risk factors. Some of us are born with congenital conditions. Some of us are born with heritable conditions that increase our risk for strokes or heart attacks. As we age, our risks increase. Women over men for stroke as we get older have a higher rate. And so there are things within us that we simply cannot change. And that is our age, our gender, and our ethnicity, and our family health history. But we can still manage them. And the reality is that we inherit a lot of this information, a lot of our genetic predisposition from our parents. But the way in which those genes are expressed really does depend on our lifestyle. And so you can have, the reality is you can have a condition where you inherit poor genes or unhealthy genes. And if you are living a healthy, well lifestyle that supports optimum health, you might not express those poor genes in a way that manifests in heart attack or stroke. And so knowing your risk on that level is really important to determine really how serious you need to be about your lifestyle changes. Now, a lot of these risk factors we can change, and those risk factors are things like smoking, cholesterol, high blood pressure, our weight, our nutrition, our exercise. All of these components dramatically increase the chances of having a heart attack or stroke. And so just addressing one of them, we'll say smoking is a common one. If you're a smoker and you quit smoking, your risk of heart attack and stroke in just 1 year goes down by half. And then every year thereafter, your risk goes down. That means that you are less likely to have a heart attack or stroke. But you can't just quit smoking. You also have to address other areas of your life, like physical activity and nutrition to complement a balanced and healthy, well life. So those are things that I know everybody hears, myself included. We often know what we need to do to take care of ourselves. The harder part is the implementation or the doing piece. And I'm definitely not perfect in this arena. For me, it's a struggle every single day. It really sincerely is. And I have to remind myself of my why. Why is it that I am embarking and challenging myself or disciplining myself in a certain arena, whether that's with exercise or diet or stress management? I really have to remind myself of that. I love you too, Aunt Stacy. I see you there. Every day. It doesn't get easier. I'm 5 years since I had my event, and in all reality, it's probably getting harder for me because I'm losing a lot of that memory around the pain and the fear of that event. Fear is a huge motivator. And so when I had that event, the first year to two after that, I was all over this. I was on this. Every day I'm eating healthy, I'm choosing these options, I'm saying no a lot more to things that I really shouldn't be doing. I'm meditating, I'm practicing yoga. That was really easy for me. Now, as I'm, kind of doing well, I don't have any symptoms. It's been a while since I had that event. It's a lot harder to live that lifestyle because you forget. And so many of us are living in this kind of interim where we know if we don't take care of ourselves now, we're going to make it a lot harder in the future, meaning we're probably going to end up with a lot of heart disease, or we'll say high blood pressure, cholesterol, those things, if we don't take care of ourselves now. But it's hard to do that when you don't have symptoms or you don't have something that's pushing down on you to say, you've got to do this or else, right? And that's why it's so important to be part of a community. I cannot stress this enough. When I was recovering from my heart conditions, and I had a pulmonary embolism, and that embolism strained and stressed my heart so much that I had a heart attack. And then the heart attack itself, because I was pregnant, and the strain of all of that, the pregnancy and the heart, actually just, my cardiovascular system just went completely kaput. I couldn't even keep a blood pressure walking around. I was dizzy, I was lightheaded, I was passing out. And I did that for a period of time. And after that, as I was recovering, it was really the community of others who had gone through this before me, who helped me out of my deepest, darkest moments, sincerely. And so I became very active in the American Heart Association's Patient Support Network, and very active in other spiritual, holistic groups that I had found and discovered just searching the web. Or, I went to a nursing conference and I came across a group of people that were thinking, and I said, I've got to talk to these people because they had gone through what I had gone through, and they had survived, and they came out on the other end, and they were there to say, Tara, you can get through this. Here's how you can do it. And we're here if you have any questions. And that was really critical in the success of my recovery. I now recognize that, even though I was a nurse, I had this information and I was part of other, clinical support networks. It was really the support that I got from other patients and other people who had gone through this or were trying to manage this condition that really helped me through those really difficult pieces. And so find your community. Find where you can share your story. Find where you can talk to people who are struggling with the same struggles and challenges you have, because you will learn from them. And you will also be inspired by them, because you will see them doing things and say, oh, well, they're doing that, then I can do that too. So you need to find those people, seek them out, and really become part of that community and actively engage with them. So I want to take a quick moment to say everything that's going on right now with the flu is a little scary for everyone, because we're all kind of watching this and everyone's either getting sick or has been sick, or they're so afraid they're going to get sick. And there's actually a study that came out not very long ago that is really supporting this notion that's been suggested over the years, that if you have the flu or a cold or some other viral infection, your risk of heart attack and stroke within that period of, we'll say, a week to 2 weeks is much higher. So this is really important for any of you that have high blood pressure, diabetes, if you're managing any other heart condition, anything. If you get sick with the flu or the cold, you are at an increased risk for an event. So what this means is you have to stay really well hydrated during your period of whether the flu or cold. You got to get up and move. You have to get your body and your blood circulating. You got to get up and move. And if you cannot do those things, then you might need to go to the hospital to get rehydrated or to manage the flu symptoms or cold symptoms in a much safer environment, because it is a real risk factor, and it's definitely something that I would say many of our providers and practitioners don't necessarily talk to us about, but it is really an important one. So spread the word about that one. That's a really important one that I don't want folks to forget. The secondary part of that conversation is this whole question of getting the flu vaccine. And I had somebody ask me last week if I get my flu vaccine, and I said no. Really nonchalantly, I said no, I haven't since I practiced as a nurse in the hospital. And the more I've been thinking about that, and the more I've actually been doing some research specifically around this whole flu heart disease link, I'm not sure that that is a smart thing to do, because the reality is that the flu vaccine, although it's not as effective as we want it to be all the time, it does dramatically the chances of death, dramatically decrease the chances of dying from the flu, specifically in children. So if you're somebody who has heart risk factors, or maybe you've had a heart event, a heart disease event in the past, it might be a good idea for you to get the flu vaccine, because you want to just make sure that you are covering all of your bases this time of year. And you might be wondering why February is Heart Health Month. And there's lots of reasons, but there is kind of this general conversation that happens in clinical circles, is the spring is often known as the dying season, because in the spring, there are huge environmental changes that happen. And if your body is not healthy or well enough to adapt to those environmental changes, we tend to see a spike in heart disease and stroke this time of year. And that spike is also associated with a rise in death from these conditions. And so it might have something to do with this flu and cold thing, or just, body changes in general during this time of year. But it's really an important time, this time, to really pay attention to the health of your heart. Stay hydrated, make sure you're getting enough sleep, make sure you're getting enough physical activity. We don't tend to do that during the winter time, and that's not helpful, particularly if you have some of these heart conditions. You want to decrease inflammation, and we hear a lot about inflammation, and there's a lot of things that cause inflammation, from diet to being overly physically active to flu, virus, bacteria, those kinds of things. So there's lots of ways that we can decrease inflammation. And one of the primary ways that we can do that is actually by paying attention to our immune system and really boosting our immune system. So there's actually also some really interesting research coming out recently that suggests in patients who have heart attack and stroke, there's actually an immune change that's occurring prior to that event. That has huge implications, because that can tell us who might be at risk, or maybe we can address certain things because of that risk. But the reality is the immune system is playing a critical role in the development of these conditions, and as well as the recovery from these conditions. And so I'm all about the immune system. This is what I do in my professional life. And I've been studying the immune system for over a decade, and it still baffles me in some cases because it's really complicated and it's really complex. And everyone's immune profile is different. It really depends on the exposures you've had over the course of your life that contribute to how your immune system protects or doesn't protect you on a daily basis. So this has really big implications. In addition to that, we also get our immune system from our mothers in womb and via breastfeeding. And so it's no longer just our lifestyle that's important. It's actually the lifestyle of our mothers and their mothers and so on and so forth. So there is a generational remembrance in our immune system that really is how we respond to every exposure we're ever against, whether that's viral or a bacterial exposure, or even stress. Stress itself looks very similar to viral bacterial exposures. And so it's really fascinating once you start getting into thinking about the immune system. It also can get overwhelming really fast. There are other ways that we can boost our immune system. So we can actually specifically eat foods that are known to boost immunity. And these foods are things like prebiotics, which are green leafy foods, probiotics, which are things like yogurts and kefirs and fermented foods, as well as some herbs and spices like ginger and garlic and turmeric. And then there are some other herbs that I've recently been using a lot of, which is ashwagandha and holy basil and maca, that are actually tonifiers, and they balance body systems. So they tend to bring things together, and they don't have one effect, they have multiple effects. So the beauty of herbal treatments and food really is that depending upon what you're eating, there are synergies that happen. And so just eating garlic every day might have a benefit, but if you eat garlic with turmeric and ginger, it's probably going to have an added benefit because they're going to synergize with one another. And so it can get really complicated really fast. And there are so many choices out there. And sometimes you don't even know where to start, which is where I was 5 years ago. I had no idea where to start. I was being offered medications. I was being offered surgical therapies. And I knew in my mind that there was something else that I could be doing to manage my condition. And I started seeking out holistic care providers. And I am so grateful that I did that, because what we were able to do was to create an integrative plan that included traditional medical therapies with holistic kind of non-traditional therapies. And really it gave me a sense of wholeness and healing. And this idea of, I don't just have to rely on this medication for the rest of my life to manage my disease. I can take this medication and change it maybe when I fly, or I'm on a long trip or something like this. But on top of that, I can also do all these other things that I know are good for my condition. And so that was really critical for me. And I recognize that there are not a lot of people who have that opportunity. So I will say right now, if you're managing some kind of condition, high blood pressure, diabetes, high cholesterol, you have your traditional way of managing that, which is primarily pharmaceuticals or medicines. And then you have a non-traditional way of managing that, which is really this whole mind, spirit, body connection that includes nutrition, diet, exercise, yoga, meditation, herbs and oils, this whole world out there that can really supplement any traditional medical approach and actually increase the effectiveness of that traditional medical approach. I think that's something that is really, really undervalued. So we prescribe medications for patients all the time, and those medications don't do what they're supposed to do. And we scratch our heads. Why are they not taking the medication? Or maybe they need to be on a different dose. But then we start looking at their lifestyle, and we start looking at other components, and we recognize that just taking this medication isn't going to account for all of these other components. And actually, there's a whole body of research out there for heart disease. One of my colleagues at WVU showed that loneliness is a predictor of heart disease. So if you're lonely or you're depressed, you have kind of an achy heart, you are at a much higher risk of having a heart attack or a stroke. That's a really big deal. And so you think about as we age and we lose many of our support systems as we age, our communities get smaller, we become lonelier and we become isolated. And that is a risk factor for stroke and heart attack. So These are conditions that are not just body conditions. They are spiritual and heart and mind conditions. And we need to be paying attention to all of those and balancing all of those pieces if we want to recover or manage these conditions in the wholest way possible. I think that's something that's definitely not talked about. And if I have any healthcare providers out there, I really hope that this is resonating with all of you, because as a provider, I knew this, I was taught this, but I can tell you that I never talked to my patients about this until it happened to me. And then I recognized how important that part was. I was managing all of these other pieces. My physical body, I was doing my cardiac rehab as the way I should, I was taking my medications the way I should, I was eating well, I was exercising. But I had a tremendous amount of fear and anxiety around that event. And it also changed who I was. It redefined me in terms of my professional and my personal roles. And it wasn't until I paid attention to that and actually managed that piece that I didn't feel like I had fully recovered. And so I do believe that there are a lot of people out there who are just kind of surviving. They're just kind of getting by and they're feeling pretty good, but they're not actually thriving because we are not offering this piece of healing to them. And so I definitely think that that's worthy of some conversation. So I have a question. What's the best way to identify and find reputable holistic healthcare providers? That is a great question, because unfortunately in this business, there are quite a few people that have kind of tainted the way. So they were either not adequately prepared to practice in this way, or they were, practicing treatments and things that didn't really have a lot of evidence to support them. And so you have to be careful just seeking out somebody. It's best word of mouth. I know it's always hard, but it's really best to go by word of mouth. You want somebody who has seen this person in that way as a holistic provider to be able to say, I really trust this person. They helped me. Or I know so-and-so who went to this person and they helped me. So that's the way that I find a lot of my providers actually is just, okay, who do you see in this area and what did they do for you? The second is there are societies, professional societies, that you can get involved in as a patient. And one of them I'm thinking of right now is the American Association of Holistic Nurses. I'm part of that society. I go to the conference, and many of those providers go to those conferences, and many patients and clients go to those conferences as well. So you can also start looking in that arena, because in that arena, you also have the practitioners who are either involved in or really interested in advancing the therapies and the treatments. And so they're at the top of their game. And that's not always, I will say that. You have to be careful with that, but not always. But that's something that I talk to a lot of people about when they've either seen their primary care clinician or they're going to somebody, they're not up on the new guidelines. And as a patient, as a client, you need to be your best advocate. You need to know your condition, and you need to trust that your clinician is practicing in the way that is the best way possible, but also be inquisitive and be curious. Ask a lot of questions. Why do we have this as the first line of treatment? Why are we prescribing this medication? I need to know the whys, because these guidelines change all the time. We just came back from the American Heart Association's International Stroke Conference, and there are new guidelines released this year for ischemic stroke. And it's going to take a long time for these guidelines to seep into clinical practice change, probably years we're talking about here. So the reality is, most of the time your clinicians are so busy seeing patients every day that they're not keeping up to date on those guidelines and those changes. So you might have to bring it to their attention. So I think those would be the ways that I would find reputable providers. It'd be the same way that I was looking for a reputable primary care, traditional medical physician or nurse. I'm really talking about word of mouth, because word of mouth goes a long way. If you had somebody who has a good experience with them, and can say, you know, I trust this person, that really means a lot. It doesn't really matter what's on their website or, you know, what people in the professional space are saying about them. What matters is what their patients are saying about them. And so you want to talk to patients. And you can ask if you're looking for a new provider, you can ask that provider to give you a patient contact you can talk to. And a good provider should have them ready to go. You know, here's my patient advocate, they can talk to you. That's what I would definitely suggest. Okay. Before we get into the last bits of the conversation, I actually want to talk a little bit about signs and symptoms of heart attack and stroke, because these are critical to know for yourself as well as for those around you. And so there are common signs and symptoms of stroke and heart attack, but what you need to know is that not everybody fits the quote unquote norm. So the common signs are for heart attack, and this is actually right from the American Heart Association website, okay? So chest discomfort that does not go away or it continuously comes back. So if you change position and it goes away for a minute, or you change position, this doesn't go away. It keeps coming back or it gets worse. And it's often described as not necessarily pain, but pressure, or this just overwhelming sense of fullness and discomfort, as opposed to like real, like you see all those people that are like, oh, chest pain, you know, people do have that chest pain, but the majority of folks who are having heart attacks actually describe it as more of a pressure, the sensation of like, you know, a lot of pressure on my chest or my back or wherever. I can't breathe, or I feel really anxious, kind of this doom or gloom feeling. And the sense of impending doom is a sign, and that could be the only sign that you have, is this really anxious impending doom feeling. The other second symptom would be discomfort in an area of the body close to the heart. And so the jaw or the face, typically the left arm, but it can also be in the other arm, the back, the stomach, it can radiate everywhere. If you're having leg pain, probably not related to the heart, but you know, can't rule it out. But typically you're going to have this discomfort in this particular area. Okay, and actually in some cases, jaw pain is what people present with, and that's it. You know, this really intense pain in the jaw, and it doesn't go away. The third sign and symptom would be shortness of breath or difficulty breathing, and this is you're just sitting there. You know, you're not physically exerting yourself. You're just really, you can't catch your breath. And there's no reason why you can't catch your breath. You just can't catch your breath. And it doesn't go away. And it could be associated with chest pain, but it might not be associated with chest pain. You could just have shortness of breath. That's it. And the fourth sign is, we're kind of lumping, what the American Heart Association is doing is they're lumping all of these other signs into the fourth sign, which is nauseousness, dizziness, lightheadedness, extreme fatigue. And in women, it could even be migraine, really, really intense headache or something like that. And so there's many symptoms, but the important piece with heart attack is that it is sudden, it comes on very quick, and it's different from your normal. There are a lot of people who say, you know, for them, it didn't feel sudden. It was kind of coming on. You know, I felt like I had the flu, or I felt like I had the cold or something like that. But in most cases, what patients will say is it really was different from my normal. There was something different. I felt different. I was scared. Or, I was scared enough to take an aspirin. If you are scared enough to take an aspirin, it's time to call 911. Because there is no reason to sit there and to think, okay, is this a heart attack? Is this not a heart attack? What is it? Call 911. You need to rule it out, because we have really good treatments for heart attack right now. And the reason why you're calling 911 is because you are not driving yourself, or you're not having somebody drive you to the hospital. That is the worst possible thing you can do. And I'm going to repeat this when I talk about stroke, because the minute you dial 911, you activate a chain of command or a system of care. So they are ready for you. when you arrive at the hospital. And actually better than that, they are taking you to the right hospital, because not every hospital is created equal. You want to go to a heart center, you want to go to a stroke center. So you are calling 911 if you have these symptoms or you know somebody else who's having these symptoms. Do not drive. Do not drive someone. They could pass out, and where there's nothing you can do for that person if they pass out in the car on the way. You need to call 911. When it comes to stroke is a little bit more vague, okay, because the majority of strokes are actually minor, meaning they don't have symptoms that are really recognizable as stroke. So there is an acronym that we use at the American Heart. It's called FAST, F-A-S-T, facial drooping, arm weakness, speech difficulties, and time are what FAST stands for. But the reality is that FAST is not a great acronym. It's not great for identification of stroke symptoms, because if you're having any one of those, facial drooping, arm weakness, speech difficulty, you're having a pretty severe stroke. And we know that most people don't have severe strokes. Most people have relatively mild strokes, which can look like numbness or tingling in one hand. That doesn't go away. It can look like confusion. I don't really remember what I did for the last 2 hours, but I'm here now and I think I'm okay. That's a lot of patients would say that. I've seen a lot of patients say that. There's a lot of conditions where stroke is, the patient doesn't recognize that they're having these symptoms. So they could have, one-sided weakness throughout their entire body, and they don't even recognize they have that weakness. We call that neglect. That is a real thing that happens. And the first person who sees them that day is the first person who notices their symptoms. And so the problem with that is we don't know when their symptoms begin. So that makes it a little difficult. So for ease and simplicity, we use FAST acronym. So facial drooping, arm weakness, speech difficulties, and then time to call 911, and time, when did those symptoms start? Because when we know when the symptoms started, then we can start them on the treatment timeline, okay? Like I said, we were just at Stroke Conference, and I am really excited, actually, to talk about what's happening in stroke right now, because there are big changes coming for stroke. The two biggest changes that I really think are important to let you know about, and I really want you to spread the word about this one, because I guarantee there are many providers out there who don't know this. There is a treatment for stroke that's very similar to what we do for heart attack. And the idea is to go in and actually pull the clot out of the brain. And it sounds crazy, but it works, and it works really, really well. And in many cases, symptoms completely reverse within minutes. They can be on the treatment table and symptoms are reversing. It's really phenomenal when you see these things happening. And this treatment is relatively new. It's been around for a while, but a lot of studies recently have come out to say this works, and we need to be doing this before we do the IV clot busters that we're used to doing, okay? The first time we started talking about stroke treatment was in 1995. We haven't had a win this big for stroke for over 30 years, right? So it's a really big deal. It's a really big deal. The problem is that not all hospitals can do this treatment procedure. So this is, once again, the importance of calling 911. Because when you call 911 and you think you're having a stroke, dispatch can tell that EMS provider to take you to this comprehensive center, this comprehensive stroke center, which might mean that you bypass a community hospital, because this community hospital can't care for you anyway in the way that you need to be cared for. You need to go straight to the stroke center. This is going to take some time for pre-hospital to shift and change, but the first thing you can do as a patient or somebody who has a loved one who's at risk for stroke, if you see these symptoms, is call 911 and say, I want to go to the closest stroke center, and make that very well known, because they will try to meet your needs if they can. The second really phenomenal thing that actually came out of Stroke Conference is, and we've had some of this data coming out in the past few years, but this year it was pretty solid. We can now treat some stroke patients up to 24 hours following the onset of their symptoms. That's very different from the 4.5-hour time frame that we had up until now. So you can imagine that huge shift in treatment time is dramatically beneficial for patients, because so many patients actually would come in at about 8 to 10 hours after their symptoms, and we would say, there's really nothing we can do for you. We're going to watch you, and we're going to provide the best care that we can, and we're just going to hope that you don't have another stroke in this 24-hour period. Now we can say you might actually be eligible for this treatment up to 24 hours. It's a really big deal. And so time is brain. Don't ever waste time if you're having symptoms that you think are either heart attack or stroke, because the longer you wait, the more brain cells or heart cells die, and they don't come back. The idea is that we're trying to save the cells that are vulnerable, and that's the whole idea of treatment. So you could be symptomatic, and those symptoms could actually worsen over a period of minutes to hours. And what we're trying to do is make sure that those symptoms don't worsen, and in many cases reverse if we can, if we're there in enough time. So time is absolutely critical. And I know some of you do know, but what my life's work has been is this notion of triage and suspected stroke. And I have spent over 12 years actually working on this idea of increasing stroke sign and symptom awareness, getting out there to educate not just our providers, but also our patients, and then creating new science around a blood test that we hope will one day sit in the back of an ambulance that would aid in this triage of suspected stroke. So I am co-founder of a company called Valtari Bio, and the whole goal of Valtari is to take this blood test, move it through the FDA, hopefully get reimbursement for it at one point in the future, and provide this as an option for pre-hospital EMS and emergency medicine clinicians who are triaging suspected stroke patients. So we still have a long way to go. We probably have about another 5 to 7 years, but we are further along than I ever thought we would be. And for somebody who has been studying this most, if not all, of my professional life, to then have turned into this patient, it's really empowering. And when I say empowering, I go to these stroke meetings and I come back with a renewed sense of urgency and a renewed sense of motivation and a reminder as to why I do what I do. And I do what I do because I want to inspire and empower others so that they're either preventing these conditions from happening, or if they're in the midst of these conditions, they know what to do, or they can holistically recover from these conditions, because it's all possible. And it's all dependent upon this network and this system of care. And it's dependent upon this community of like-minded individuals who is equally looking at body, mind, and spirit. And that's been my goal with Deep Roots Healing, and taking everything that I have learned in the science and academic and clinical space and translating that in a way where we as patients and consumers of this information can actually understand it and use it. What does this really mean for me? Because all of these recommendations and everything I've talked about here tonight, symptoms, risk factors, they don't really mean anything until you understand them for yourself, because my risk factors are different from your risk factors. And how I'm going to manage my stress is going to look very different from how you're going to manage your stress. And so you really do need to create your own holistic recovery program and include others in that recovery program that support you in that way and that want to help you and guide you and find your path forward, because it's possible. You can absolutely have a heart condition, whether that's heart attack, stroke, or any other heart condition, and come out of that condition stronger and wiser and even better. In the end, it can happen. It takes effort and it takes guidance and it takes time, but it can happen. So don't ever, don't get stuck in these emotions. It's really common to have depression and anxiety and even post-traumatic stress after you've had a situation such as this. It's not uncommon to have these feelings and these symptoms. The problem is that we don't typically seek out help for these feelings. We seek out help for the body and for those physical symptoms. We don't tend to seek out help for the psychological symptoms that come with them. And like I said, it wasn't until I actually addressed my recovery in a holistic way that I didn't feel like I fully recovered. Now I can say I am thriving. 100%. I am thriving in this new life I created. And I'm actually doing better than I was before my event, if you can believe that. And the reason is I'm now really taking a look at my life in a very different way. I've reprioritized a lot of things. I don't manage my time. I manage my priorities. I really pay attention to my health, and not just my physical health, my emotional and my spiritual health. And because of that, I feel like a better person. I'm a renewed person. I really sincerely am. And the last thing I'll kind of leave you with is this idea of sharing your story. And, for me, this was part of my healing journey. Every one of us has a story to share, and we are storytellers. This is how we teach people. We teach people through story. There is, at the American Heart's Patient Support Network, you can share your story. So you just kind of get on that forum, you can log on, talk to people, but you can share your story in a way that others can see where you are and what you've done and how you've survived and how you've succeeded. And I learned a lot from participating in that forum. It's a fantastic forum. And I recommend it for anyone, even if you're just managing high blood pressure. There are forums in there for diabetics. There are forums in there for people who are just managing high cholesterol. So, it's really a network of others who are challenged in the same way that you're being challenged. And we learn so much from one another when we have these kinds of conversations. So I think that was what I wanted to address. I'm going to post my notes. I actually wrote up notes for this conversation that I want to share. So you have this material on hand and you can share it. Please share it with whoever you want to share. And don't forget to wear red tomorrow. Tomorrow is National Wear Red Day. And the reason why we wear red is to raise awareness. So I've got my Go Red pin. It's to raise awareness of heart health and to understand your symptoms and to talk to other people about their heart health. And that's what we do in February. We are out advocating, we're out educating, and we're out inspiring and empowering others with knowledge and information, and then a network and community. And that's what I am charging all of you with today, is to go home, take this information, look at it and listen to it for yourself, and then share it with others. So I have my little ones who wanted to participate in today's video, and let's see if, oh yeah, they're still, come on, everybody's ready. Maybe if there are questions from anybody who's participating, now is a good time to ask some questions before we end. Okay, so if there are no questions, then what I'm gonna do is, these guys are always dying to get in my videos, and we're all wearing red. We just took our annual Wear Red photo, and I'm gonna be posting that tomorrow and posting it up on our social media posts. So I was gonna ask Gracie, what do you do to take care of your heart?
You eat healthy and stuff that need good food and stuff.
You eat good food. That's a great one. Yes, we like to eat good food in this house. Bobby, would you like to tell everybody what you do to take care of your heart?
Eat bananas.
Eat bananas. Yes, bananas are really high in potassium, so that's actually a really good thing to do for your heart. Great job. Is there anything else that we do as a family to take care of our heart?
Let mommy be nice.
Oh, mommy, be nice. Right? It's good to be nice and to love. So as a family, we do lots of things together. We live together, obviously, and my health impacts the health of them and impacts the health of everyone else. And so we try to eat well, we try to get out and exercise, we say our prayers, we help each other if we're really feeling anxious or scared or frustrated about something. And what else do we do to help each other out? We love each other.
We love each other.
Yeah, we love each other. So that's what this is all about. Loving one another and helping each other, and that's what these guys remind me of every single day. This is my why. When those days I'm having a really hard time and I'm, not motivated to do my exercising, or, I'm really tempted to just stop everything I'm doing with my diet, all I have to do is take a look and say, this is why I'm doing what I'm doing. And so I hope that I have provided some additional education for you today, inspired you in some way, and really sincerely hope that you go out and talk to other people about heart health this month, because it's really important for us to spread the word. So you guys have a great night. Thank you all for participating, and I'll keep you posted for the next time we have a seminar. Say bye.
Bye.